coming to the Cardiology Christmas December issue. Ho ho, Veronica's the other ho. Okay, so today we're going to be going through ischemic heart disease. So ischemic heart disease is when there is ischemia or reduced blood flow to the heart, the coronary artery specifically. So one thing to keep in mind when we're talking about ischemic heart disease is that this is synonymous with coronary artery disease because the ischemia is in the coronary arteries. So you can use either one. So ischemic heart disease can be broken down into 4 conditions. We have our NSTEMI, STEMI, unstable angina, and stable angina. And then 3 out of 4 of these are considered ACS, or acute coronary syndrome. So acute coronary syndrome is unstable angina, STEMI, and NSTEMI. So when your patient comes in, you're trying to differentiate. The first thing when they come in with chest pain is you're thinking, okay, is this stable angina versus unstable angina? So stable angina is relieved by rest or nitroglycerin. So if you give your patient nitroglycerin and that relieves their chest pain, that is stable. If you give them nitroglycerin and their chest pain persists, that is unstable angina. So another thing to note is when you are trying to differentiate between the next 2 things, STEMI versus unstable angina. You go ahead and do an EKG because the patient has chest pain, and you'll see ST depression or T wave inversion on both of these, unstable angina and NSTEMI. So then how do you differentiate between unstable angina and NSTEMI? Because you have the ST depression or T wave inversion, you get cardio biomarkers. So we can see troponin 3 to 6 hours after the beginning of ischemia. And so if there's positive troponin, it's an NSTEMI. Negative troponin, then you can classify that as unstable angina. So then that leaves us to how do we differentiate between NSTEMI and STEMI? That one's very easy because NSTEMI on an EKG you have the ST depression or T wave inversion, whereas on a STEMI you have ST elevation. And then what is the difference? Is speaking anatomically, with an NSTEMI we call this a subendocardial infarction. So it just goes through like a little bit of the heart wall. So like that is an NSTEMI. And then a STEMI we also call a transmural infarction. So it goes all the way through. There's infarction or tissue death in all of the myocardial wall. So then I'll go real quickly through, if we have a STEMI, we want to either initiate one of 2 options, take the patient to the cath lab, so to do a stent, PCI, or CABG, and their second option is fibrinolytics. So the way to keep these in your mind is that we have door to balloon, so that means the cath lab, and door to needle, so that means initiation of fibrinolytics. So our door to needle time is 30 minutes. Our door to balloon time is 90. I remember door to needle 30 because you need a 30 rack of beer. And another thing to note was with the door to balloon time is 90 minutes. If you have arrived with your patient at a hospital that does not have cath lab capabilities and you need to transfer, then the door to balloon time is 120 minutes. So that's including transfer. So that would be if you had a patient that shows up to Salt Lake Regional, they don't have a cath lab, you have from the moment they say provider or regional until they're in the cath lab at the U, 120 minutes. So door to needle 30, door to 90, balloon 90, and door to balloon with transfer 120 minutes. So thank you for tuning in to ischemic heart disease, synonymous with coronary artery disease. Don't forget to comment below.